Nutrition for prevention of a lot of chronic diseases, including cancer. And she has founded the Plant-Based Health Professionals UK in 2018, which is a non-profit organization. And the mission of that organization is to provide evidence-based education and advocacy on whole food, plant-based nutrition and lifestyle medicine. She also authored a book, Eating Plant-Based, Scientific Answers to Your Nutrition Questions. She co-authored this along with her sister Zaira, and that was published in January 2022. And she's also co-edited the textbook, Plant-Based Nutrition in Clinical Practice, which was published in 2022. And she has a number of peer-reviewed papers in the field of lymphoma and nutrition. She's also the sustainability lead for pathology practices at the Royal College of Pathologists. So who better than Dr. Shireen Kassam to speak to us this evening on how diet and lifestyle can help navigate cancer, prevent cancer, and also through the survivorship phase. Welcome, Dr. Shireen. Over to you.
Thank you very much. Really nice to be back again with you all. I do hope I'm not covering the same thing as last time. I can't really remember, but anyway, it'll be updated nonetheless. So I hope you all get something out of it. It's a very broad topic, so it's quite general, and then hopefully in the Q&A we can get into some more specific questions. You've heard all about me, so you don't need to hear that. So what I hope to cover in the next sort of 35-40 minutes is describe the role of diet and lifestyle for cancer prevention, and then discuss the impact of diet and lifestyle approaches for improving quality of life and survival after a cancer diagnosis. And the term survivorship actually starts from the moment somebody has been diagnosed with cancer. And so it's right from that point of diagnosis till, hopefully long life afterwards and dying of something unrelated. But it provides us with additional phases where we can input to somebody's quality of life. So just to set the scene, we'll all know that cancer is a leading cause of death globally. In some countries, such as Canada, it's now the top leading cause of death. But globally, 1 in 6 people die of a cancer-related condition. And globally still, the commonest sites are lung, breast, prostate and colorectal cancer. And that's where we'll find most of the evidence or clinical trials relating to diet and lifestyle, just because of their higher frequency. In general, we can say that at most our genetics, so the genes we inherit from our parents, contribute to 10% or less of cases of cancer. So the rest is open to modification through, addressing lifestyle and environmental factors. From the data we have, at least 40%, closer to 50% of cases of cancer could be prevented if we addressed modifiable risk factors. Now, the image on the left is data on India taken from the WHO website, which has an excellent resource with infographics from the Cancer Observatory. So you can see there that the commonest cancers differ slightly for you guys. In India, you've got breast, lip and oral cavity, which I assume is sort of related to smoking, cervical cancer, lung and esophageal, and then a rather large section in grey, which is other. And when you think about the sheer numbers, again from the Cancer Observatory, these are data for India in 2022, their latest data set. There's nearly 1.5 million new cases of cancer in India, almost 1 million deaths from cancer. And then, the number of people with cancer in over a 5-year period will be more than 3 million. So a huge, huge burden in terms of healthcare and quality of life. This publication in 2022 just demonstrates what we know is occurring globally, and that cancer incidence in India is rising. There's 3 times increase in cancer-related ill health since 2004, and 3 of 5 people in India with cancer will die from it. So if you get a diagnosis of cancer, it is potentially life-altering. And again, this lists from that publication in 2022 what the commonest cancers are for men and women living in India. When you look at global data around modifiable risk factors, we've learnt that, as mentioned, 45% roughly of cancer deaths and morbidity from cancer is preventable if we addressed behavioral and metabolic risk factors. So the leading risk factors in this large global study were smoking, alcohol use, and elevated body mass index, so carrying excess body weight. In the UK, the Cancer Research UK provide us with loads of great shareable infographics around cancer. And again, just to reiterate some of the preventable, known modifiable risk factors when it comes to cancer. Unfortunately, tobacco industry is still causing huge amounts of deaths, and cancer being one of those deaths. So in the UK and globally, tobacco smoking remains the leading cause of cancer and cancer death. But second to that now, causing around 5% of cancers, is carrying excess body weight. And then there's not consuming enough fruits and vegetables, unsafe exposure to the sun, drinking alcohol, and we'll come back to that, there is no safe limit, and sedentary lifestyle. And in India, from what I've gleaned from the internet, 70% of cancers could be prevented in India if we paid attention to tobacco smoking, infectious diseases, alcohol, diet, and physical activity. And in addition to global increases in the rate of cancer, we've got increased rates of cancer in young people, meaning people under the age of 50. And there's a number of hypotheses. People suggest that we don't exactly know why, but I think many of us would hypothesize that it is our sort of industrialized, westernized lifestyle. And if you look at the kind of risk factors, it's all of the things I've mentioned already: carrying excess weight, lack of physical activity, sedentary lifestyle, the Western style diet, and interestingly, for a group of healthcare professionals, sleep pattern, increased night light, etc. So there's a lot we can do, but the worrying trend is that cancers are increasing in people under the age of 50. Now, these are the international guidelines for preventing cancer. There's 9 recommendations, and they haven't changed since 2018. So be a healthy weight, be physically active, eat a diet rich in fruits, vegetables, whole grains, beans, nuts, and seeds. So that's a healthy plant-based diet. Limit processed foods, red meat and processed meat, sugar-sweetened beverages. So when it comes to sugar-sweetened beverages and processed food, it's mainly because of its association with carrying excess weight, but I'll come back to that. Regards to processed meat, which may not be such a big issue for people in India, but we know that the WHO has classified processed meat as a group 1 carcinogen and red meat as a group 2A carcinogen, so probably causes cancer. So there's no place for that in the diet. Limit alcohol, I'd say avoid alcohol. We'll come back to supplements, but there's no evidence that using supplements in supranutritional doses plays a role in cancer prevention. And if you're a mother, breastfeed if you can. The guidance is to breastfeed for as long as 2 years, along with obviously weaning onto foods from 6 months onwards. And that helps to reduce the risk of breast cancer in women, and in the child, lower rates of obesity and diabetes. And then follow these recommendations after a diagnosis of cancer. And they make the point that they have not included tobacco here because we all know it causes cancer, but also that these recommendations will help us prevent other non-communicable diseases like cardiovascular disease, type 2 diabetes, dementia, etc. And for me, who's hugely interested in nutrition, it's of note that 5 out of the 9 recommendations relate directly to dietary risk factors. Another document that, if you haven't read yourselves, is really useful to look at. It answers a lot of questions our patients ask us. The American Cancer Society Guideline for Diet and Physical Activity. I think there's something for everybody to learn from that. I've summarized their findings here in terms of their recommendations. Green Arrows mean, things that reduce the risk of cancer. Red increases the risk of cancer. And then there's some degrees of uncertainty as well. We'll come back to some of these things in a moment. I've added green tea. I mean, I think there's quite a lot of data suggesting it's a healthy drink to consume if you enjoy it. It's not essential, but there are some data, certainly in sort of higher doses, that it can support lower rates of cancer. Looking at your India Cancer Society, very similar, sensible advice to the World Cancer Research Fund. Do not smoke or chew tobacco, limit alcohol, eat a diet with plenty of fruits, vegetables. And I would have liked to put the words whole grains, but they just say grains. Limiting refined grains and focusing in on whole grains is key for fiber and other nutrients. Do not be overweight, lead an active life, and sleep a minimum of 7 hours a day. So really sensible advice. So the question is, do these guidelines work? And we've got large meta-analysis and data sets demonstrating that yes, absolutely. I think the trouble is that most of us don't adhere to all 9 recommendations. But when you look at population studies, people adhering to those 9 recommendations have lower rates of cancer. There's a dose response like you'd get with anything where there's a causal relationship or at least an association, in that the more you stick to the recommendations, the lower your risk of cancer, with each additional factor or risk factor, if you stick to it, reducing your risk of cancer by 10%. And there were particular benefits, certainly in this meta-analysis, for reducing the risk of breast, colorectal and lung cancer. And then the next question will be, well, we know what the risk factors are. What happens if somebody decides to change their lifestyle and address this and become healthier? Does that reduce your future risk of cancer? A bit like smoking, the moment you stop smoking, there's benefits for cardiovascular health, cancer risk, etc. And again, the answer is yes. They looked at a large study from Sweden, looking at people, following them for, over 12 years, looking at people who changed their lifestyle in a positive trajectory. And what they found was that if people over that 12-year follow-up had improved their lifestyle habits, they reduced their risk of cancer by 20%, with the greatest benefits being for stopping smoking and for losing weight. And just a reminder of what I've already said is that study after study demonstrates that our genes are not our destiny. They may alter our risk, but we can support people to alter their genetic risk of developing cancer by adopting healthy lifestyle behaviors. This is just an example of colorectal cancer, where they showed that people with the highest genetic risk benefited the most from sticking to the World Cancer Research Fund recommendations, with a 42% reduction in risk over the 6-year follow-up. Sensible conclusions from the authors saying our study provides strong evidence to support lifestyle modification for colorectal cancer primary prevention. I could have used other examples from other cancer data sets, but colorectal cancer is one of our most preventable. So this brings me back to lifestyle medicine. I'm sure a lot of you have heard of the specialty or have got the qualification from the International Board of Lifestyle Medicine. It's an adjunct specialty that pays attention to 6 pillars of lifestyle: nutrition, exercise, avoiding toxins, stress management, restorative, good quality sleep, and healthy relationships. And together we know that if we were all to stick to these healthy habits, we could pretty much prevent or delay 80% of the chronic conditions we see in our healthcare systems. And when it comes to cancer, up to 40%, if not more. And the reason these healthy habits, and particularly the dietary recommendations, are so impactful is because they really impact positively the driving mechanisms of cancer development. So there's different stages of cancer development. Cancer starts, decades before it's clinically apparent. And that's why, you can address it by adopting healthy habits as early as possible in your life course. But the things that drive cancer are insulin resistance, cellular stress, inflammation, exposure to carcinogens like alcohol and processed meat, air pollution as well, unfortunately, the gut microbiome that was referred to at the start, and having a diet and lifestyle that elevates growth factors such as insulin-like growth factor and some of our reproductive hormones like estrogen. But I think what's not spoken about enough is the fact that underlying chronic conditions can also increase our risk of cancer. So because there are shared mechanisms of disease development. And so, we'll recognize in our clinic rooms that people who come to see me with cancer often have cardiovascular disease. They certainly have high cholesterol, high blood pressure. In the UK, 1 in 5 people have prediabetes or diabetes, type 2 diabetes. And so having an underlying condition in this study, 400,000 participants in a cohort study from Taiwan, it showed that about a third of the risk of dying from cancer came from having underlying chronic conditions. And, that this would shorten one's life by, up to 15 years if you had underlying chronic conditions and unhealthy lifestyle habits. Interestingly, physical activity alone in this cohort was shown to reduce people's risk of cancer by 40%. So all the healthy habits are important, even though diet is my pet topic. So just to move on to what are the dietary components that are useful to emphasize, as was referred to at the beginning, we may not have exact foods that we know to prevent cancer, but what we know is there are diet patterns that are centered around fruits, vegetables, whole grains, beans, nuts, and seeds that promote healthier living, reduce risk of cancer. And this is shown here in the plate on the right, and described by the American College of Lifestyle Medicine, that they recommend a diet plan that's predominantly based around a variety of healthy plant foods. So you've got half a plate of fruits and vegetables, a quarter whole grains, a quarter plant sources of protein, mainly water for thirst, using lots of herbs and spices because they're delicious, but also have, beneficial properties. And this type of diet can be adapted to any cultural or traditional diet pattern. It's hugely inclusive as well. And it is the one. I mean, it can be, completely plant-based. It can be almost plant-based. It can be Mediterranean, typical South Asian, whatever you want to call it, as long as it's centered around healthy plant foods. Just to reiterate that dietary risk factors are a cause of cancer, or at least increase your risk of developing cancer. And globally, there are about 1 million cancer deaths due to poor diet. In the UK, we've estimated that about 5% of cancers in the UK are due to unhealthy diets, and mainly because we're over-consuming ultra-processed and prepackaged foods. Our diets are low in fiber, insufficient in the healthy plant foods that we know have all the phytonutrients that prevent cancer, and our diets are too high in red and processed meat. You haven't got all of these same problems, but I'll come on to the India context. And this is just a reminder that processed meat is a group 1 carcinogen. It causes colorectal cancer. Red meat is a probable carcinogen. It probably causes colorectal cancer. Slightly different issues in India from my understanding. Excess meat consumption is not a major issue, but problems around diets being low in calories and protein can be an issue with food security. But in general, too high in grains, so refined grains and cereals, and processed foods with insufficient consumption of fruits, vegetables, whole grains, beans, nuts, and seeds, despite the traditional Indian pattern being high in legumes. And so if we think about diet patterns that are known to reduce the risk of cancer, we've got a large data set from the UK. It did include South Asians in this data set from the UK Biobank, and they looked at typical diet patterns and were able to demonstrate that a meat-free diet, vegetarian and vegan, reduced the risk of cancer with particular benefits for breast and prostate cancer. There's a particular benefit from emphasizing plant foods in the diet, whole fiber-rich plant foods for GI cancers. And it's kind of obvious, isn't it? The diet directly is linked to our gut health. It actually touches our gut cells. Either you can nourish them or you can, provide foods that are going to be toxic. And so this large analysis, including, subjects of more than 3 million subjects, was able to show that all types of healthy plant-based diets, whether it's vegetarian, vegan, whatever you call it, Eat Lancet, reduce the risk of GI cancers. Just a word on dairy. You'll hear and you'll see in the documentation from the World Cancer Research Fund and the international organisations that dairy reduces the risk of colorectal cancer, and that's absolutely true. There are associations with consumption of dairy, so cow's products, and reduced risk of colorectal cancer, but it's not anything special about the dairy. It's the fact that the dairy is a vehicle for calcium, so calcium is the reason. So same effect with calcium from other foods like beans and greens, calcium supplements, and you can make a better choice, in my view, than consuming dairy, because dairy also comes with some risk. So when you think about what's in the diet, you will always have to think about, well, what could you do that's better? What could you substitute that would be even better? Because there is a strong association between the consumption of dairy and prostate cancer in men, and possible associations with breast cancer and endometrial cancer. And we've got some data sets from the Adventist Health Study demonstrating that people in their cohort who drink soya milk rather than cow's milk reduce their risk of breast cancer and prostate cancer. So it's all about, what can we do better? Dairy is not necessary. There are better choices we can make. We can get calcium from fortified plant-based drinks, but also from, greens and beans and nuts and things. Ultra-processed foods, the data is developing. There is some preliminary data to suggest that there is an association between higher intakes of ultra-processed foods, so food-like substances that have had nutrients removed, additives, emulsifiers added in, are often in plastic packaging, that increase the overall risk of certain cancers. So really best to minimize. I mean, none of us are going to avoid processed foods or convenience foods. That's not realistic, but it needs to be a smaller part of your diet, 5 to 10% maximum. Alcohol, I think we're all clear, aren't we, that alcohol causes cancer. There is no safe limit. All the guidelines say this. Any myths you've heard around improving heart health is absolutely a myth. Overall, globally, alcohol does more harm than good. And so in case you're still not convinced, you can read these documents that clearly state that we've been sort of led down the garden path by the industry, and really any benefits from red wine come from the polyphenols in the grapes. So let's have the fruits and vegetables and the grapes. So just moving tack a little bit, it's absolutely clear that there's strong evidence that physical activity reduces the risk of cancer up to at least 13 cancers, because it addresses all those key mechanisms that I talked about a few slides ago. It promotes a healthier weight, reduces insulin resistance, reduces growth hormone levels, reduces inflammation and oxidative stress, supports a better immune system, alters your gut health. It can be involved in positive gene expression profiles, and can prevent the shortening of our telomeres. So I'm just going to move on to lifestyle interventions during cancer treatment. And this is probably an area which I think many of you will agree with, that we need more evidence, but there's some common sense principles that make sense for people from the moment they're diagnosed with cancer, and it really is a moment to impact their health positively. I'm glad I picked a breast cancer example now with the expertise in breast cancer. So this study, relatively recent, was a randomized study looking at the impact of a diet and exercise intervention in people diagnosed with breast cancer. And the dietary intervention was to support people to eat more plants. It was very much in line with the World Cancer Research Fund. So they compared it to usual care, so whatever their physician would talk to them about, compared it to home-based exercise and nutrition delivered by oncology certified dietitians. And after the follow-up, they were able to show that the intervention group were more likely to have a pathological complete response. So some emerging data that supporting people at the point of cancer to adopt healthy diet, physical activity, more the better with all of these things, but as much as they can is beneficial. And I think some of the reasons that healthy lifestyles and certainly dietary interventions are important for people with cancer is because we're understanding the role of the gut microbiome. So a reminder that our dietary intake really impacts the health of our gut microbiome. The gut microbiome will use components in the diet such as fiber and polyphenols to make metabolites such as short-chain fatty acids that then communicate with the rest of the body. It's amazing. There's been described so many lines of communication between the gut and other organs, and also, you know, about 70% of our immune system sits in the gut, so it involved with maintaining a healthy immune system. So I just wanted to highlight, well, so what we've learned is that people eating more fiber-rich foods, more fruits and vegetables, are more likely to achieve a remission with certain types of anti-cancer treatments, particularly those targeted at the immune system, like PD-1 inhibitors, or in my profession of hematology, stem cell transplantation, so immunotherapies, because it supports a better immune system. And there's a dose response in certain studies that have looked at it. The more fiber you eat, the more likelihood of getting a remission and staying in remission. We need more data, but I think there's absolutely no harm associated with supporting people to eat more plant-based foods at the point of diagnosis. And I really like this paper. If you haven't read it already, I would encourage you, especially if you are an oncologist. It's called, this is the actual title of the paper, The Gut Microbiome, What the Oncologist Ought to Know. And what's relevant for us is that there's some things that we can put into action right now. We can get people to eat more plants and a variety of plants, because variety is really important. Polyphenol-rich foods, which are all the dark-coloured fruits and vegetables like tomatoes and aubergines and red peppers and things. Dietary fibre is so important, and fermented foods, so things like kimchi, sauerkraut, water kefir. You know, in India, you guys have your idli and dosa and stuff, which is fermented. So I'm just going to speak about supplements. There's no study, and I did some studies on selenium. There's absolutely no studies that have shown convincingly that hyper-nutritional doses, so higher than you need for nutritional adequacy, of supplements can prevent cancer. In fact, a lot of the studies have shown harm. Also, certain supplements, when it's outside of just a healthy diet, may interact with anti-cancer treatment. So, you know, if your patients are taking supplements, please do check with your pharmacist. Or there's actually a useful app called, I think it's called About Herbs, if I'm not, yeah, About Herbs from, I'm just looking it up on my phone. I should remember these things. And it's free. And oh, anyway, look up the app About Herbs, because it allows you to check interactions between sort of nutritional supplements and herbs and stuff and anti-cancer treatments. There are some data suggesting that people with cancer who take high doses of antioxidant supplements may negatively impact their outcomes. Now, of course, this might be reverse causation. You know, people with the worst prognosis are more likely to try supplements and additional integrative cancer approaches. But I think during cancer treatment, best to always check with your cancer pharmacist. The only supplement that I would suggest that people should take if their levels are low is vitamin D. Now, there's been lots of studies on vitamin D. I don't think there's any convincing data that taking vitamin D supplements reduces the risk of cancer. But what's more convincing is that there seem to be better outcomes for people who've got a diagnosis of cancer, having cancer treatment, if they maintain adequate levels above 75 nanomoles per litre. So, you know, it's not in all the guidelines, but I think there's very little harm that could come from this. You know, in the UK, certainly in the winter months, we're all meant to supplement with vitamin D. I don't know what levels are like in India, but I suspect not, you know, most of us are not spending enough time in the sun to maintain adequate levels, especially if we've got darker skin. So, final part around what happens when people are either sort of early stages of cancer and you're just active surveillance, you don't need treatment, or you've completed treatment and you're trying to improve outcomes. So do the cancer guidelines work in people once they've finished their cancer treatment? Again, the answer is yes. This example is colorectal cancer. They looked at healthy habits, just like the World Cancer Research Fund guidelines I showed you, and they were able to show that people sticking to these guidelines had a reduced risk of death, an absolute risk reduction at 5 years of 9%, which is not bad. It's a pretty good outcome of reducing your risk of death by 9% absolute level if you stick to healthy habits. You'll recognise the work of Dean Ornish, who's the father of lifestyle medicine. He's a US physician who's done some of the seminal work in using intensive lifestyle interventions for people with established disease. His first kind of, very famous study was in heart disease, published in the Lancet in 1990. But he also did a very similar intervention in his work with people with early prostate cancer. So he used his lifestyle medicine approach, which is a low-fat plant-based diet, stress management, group support, physical activity, stopping smoking, in 93 people with prostate cancer, randomized them to his lifestyle intervention or usual care. After 1 year, he was able to show that his lifestyle intervention was able to reduce the prostate-specific antigen level in the lifetime, in the usual care, the prostate-specific antigen level went up, albeit small numbers, but statistically significant. But what's important to us as cancer doctors is what happened to the patient and their outcomes. And at 2-year follow-up, only 5% of the lifestyle group needed conventional treatment compared to almost or over a quarter of the control group. And he was able to show in separate studies that his intervention was able to lengthen the telomeres. He looked at this in peripheral blood mononuclear cells, and this is just after 3 months. And he was able to show in pre and post prostate cancer biopsies at 3 months that there was a change in gene expression, with changes in over 500 genes, with cancer suppressor genes being turned on and cancer promoting genes being turned off. There's also further observational study that in people with prostate cancer, this was in non-metastatic prostate cancer, people who'd finished treatment either with prostatectomy or radiation, people sticking to an overall healthy plant-based diet were much more likely to have better indicators of quality of life, sexual function, urinary function, hormonal function. Similarly, we've got guidelines around exercise during cancer treatment, the old age, recommendations to just, rest when you're having treatment is not good for our patients. Our patients should be supported to do whatever physical activity they can do, including strength building. And this is in all our guidelines. It can improve mental health, quality of life, reduce anxiety, depression, improve fitness, make you much more likely to tolerate treatment, and especially in the kind of pre-op setting of prehabilitation in people with lung cancer. There's good evidence that after you finish treatment, that regular physical activity can reduce your risk of the cancer coming back and dying of cancer. We've got most of this evidence in the common cancers, breast, colorectal, and prostate cancer. There is some emerging data that physical activity can deal with some of the side effects of chemotherapy, and some of you will have seen people who complain of what we call brain fog or chemo brain when during treatment it's a real phenomenon. People have problems with memory, executive function, concentration, and it's because of the inflammatory response in the brain to the anti-cancer treatments. But physical activity can alleviate some of these issues. And we've got data here from the UK Biobank, again, looking at 35,000 people followed by 14 years, and all of these people had had a diagnosis of cancer. And they looked at these 5 healthy habits: not smoking, moderate alcohol, adequate sleep, healthy diet, which was in line with the UK guidance of eating more fruits and vegetables, physical activity, and they were able to show that there was a reduction in some of the comorbidities that is often present in people who've had cancer treatment, cardiovascular disease and type 2 diabetes. So people sticking to the healthy habits could reduce their risk of both by more than 40%. Each lifestyle factor reduced their risk of developing cardiovascular disease and type 2 diabetes by 10 to 13%. And of course, we know that these healthy factors are useful to reduce the risk of second cancer, because if you had a first cancer, you're at an increased risk of developing another cancer. We've got data from the Masala study demonstrating that a healthy plant-based diet can support South Asians, and these were South Asians living in the US, to reduce their risk of cardiovascular disease by lowering weight, cholesterol, visceral fat, which we know is so important to address in people with South Asian origin, and is also important in living well after a diagnosis of cancer. So coming to the end now, what I've demonstrated is there's a rising burden of cancer globally, in part because of the aging population, but also there's rising incidence in young people. This is also partly driven by increasing comorbidities. I think all of us in healthcare will recognise that we overemphasize treatment versus prevention. I mean, I'm all for treatment of cancer, but we also need to deal with the upfront preventable modifiable risk factors. And this is because, pharma and industry money is mainly spent on developing treatments that is going to bring income to the companies. And we often have, certainly in the UK context, we have poor investment from our policymakers in making these healthy lifestyle and environments accessible. We have food insecurity, you guys have food insecurity, healthy diets are not accessible to everybody, green spaces that are safe with clean air, green space, access to nature to do your physical activities not always available to people. There's financial constraints as well. And I don't end a talk now without mentioning the fact that climate change is a health emergency. It's going to change the way we all practice medicine. It may already have done for some of you. Not only are there extreme weather events and heat and floods and fires that prevent us being able to carry out and effectively deliver healthcare, we're going to have big problems with migration, and we're going to see some of these cancers change. And, air pollution rising, we're going to get more lung cancer, heat. Exposure to higher temperatures is also going to have a negative impact on our health. So final, large proportion of cancers are preventable. Diet and lifestyle are really important, and we can make a big impact on people, even if they've got a diagnosis of cancer, to live well, live longer following their diagnosis. I teach this course at the University of Winchester. It's fully online, accessible to you in India. I feel like it's relatively well priced at £250 UK pounds, and it's 8 weeks online. Facilitated, go through all the pillars of lifestyle medicine and CPD accredited. This is the other course I run, a bit more intensive, purely on plant-based nutrition, but it's been accredited by the British and American College of Lifestyle Medicine and a local CPD certification service in the UK as well. We have an excellent podcast run by 2 of our GPs, so please do listen in a nutshell, find it on any of your podcasts. And these are the 2 books that were mentioned at the start that I've been involved in, so you can buy them wherever you buy your books. So thank you very much.
Thank you, Dr. Shireen, for that very, very informative talk on diet and lifestyle changes, which can prevent cancer and also help people through the survivorship. So a lot of interesting points. One is that, the genetic risk can be reversed, especially in colorectal cancer, by following a lifestyle, which is kind of more conducive for prevention. The second is in cancer patients, where we see a lot of reduction in, the survival comes down because of the comorbidities. And if we can address those as well with this lifestyle change through treatment and in the survivorship, it really brings down the recurrence rate. So very, very interesting points. And I think a lot to take home from this. But one concern is, as oncologists, how many of us spend enough time or create a system within our practice to ensure that our patients are following it? So it's a huge task that we all need to work on.
Agreed. And I'll just mention that it's not quite accurate to say you can reverse your genetic risk, but you can significantly reduce the genetic risk, because of course reduced risk is not no risk, and we may all get cancer at some point, but at least we've done our best to reduce that risk, for sure. And I agree. I think I struggle with incorporating this into clinical practice because the systems available to me is not conducive for supporting people and their families to adopt the healthy lifestyle habits.
Yeah. So I think we have a few questions which we can take on. is there any relation between COVID-19 and an increase in cancers?
Not that I'm aware of. I haven't seen robust evidence. I know that we in the UK had a problem with late diagnoses and reduced, and presentation that occurred later because of all the restrictions and trying to keep people away from hospital. But I'm not aware, unless I've missed something, of a direct correlation between COVID-19 and increased risks of cancer.
There have been no publications in that area as well, right?
I would have to double check. I don't remember seeing any.
Yeah.
But maybe,
The
Fatima,
next question that we have is how much, although there's a lot of talk going on, especially we've seen a spurt of male breast cancers, which are considerably rare soon after COVID, but we don't know the reason why. The next question is how much proteins do you recommend for patients with cancer and sources of proteins?
Yes, I mean, obviously sources, you won't be surprised that I'll be focusing on healthy plant sources of protein. So beans, pulses, all sorts of legumes. Sometimes even, some of the what we term as meat alternatives like seitan are useful to incorporate if people are struggling. I think in terms of how much, I think it really is dependent on the patient, and what treatment they're having, their catabolic rate, do they need to put on muscle and weight and all those sort of things. So I think, it is useful to have dietitians involved, but in general, people try and get at least sort of 1 gram per kilogram. But that will need to be personalized based on the type of cancer and what a person can manage and what their utilization of protein is in their sort of hypercatabolic state, if they're particular cachexis or not. So I think the answer to that is it depends. Yeah.
There's another question on IBS, probably not directly related to this topic today, but are there any practical tips to help them increase their
Yeah. So yeah.
increase?
Yeah, so I think, obviously, again, one needs support from dietitians if people are struggling with certain nutrients or eating more fiber. We've got a fact sheet on our website that I posted the website details on the chat that addresses, how to increase fiber intake in people if they're struggling with bloating or GI symptoms. But doing it slowly, doing it gradually, starting with smaller pulses like lentils, having them mashed up in, like or blended up so that you break down some of the structures, washing and soaking and making sure those sort of oligosaccharides that sometimes cause the bloating and the discomfort are reduced. So do have a look at that fact sheet around bloating. And then we've also got a couple of fact sheets on IBS as well. But I think, when somebody has a particular GI, whether we call it a disorder, but a condition or whatever, I think you do need some sort of personalized dietetic input to support those dietary changes.
Yeah, thank you. What about the use of soy in breast cancer patients?
Yeah, well, I'm sure you have a view on this too, but I think it's a healthy food to include for everybody, including people who've had breast cancer. The evidence is quite secure that there's no harm and there may be some benefit, and certainly it's a healthier source of protein than animal-sourced foods.
Yeah. What about prostate cancer? What's your take on soy in prostate cancer?
Yeah, beneficial. I mean, certainly from the observational data. And then we've had like a huge umbrella study bringing together all the data on soya and its impact on health. And it absolutely shows benefits for so many conditions, including a number of cancers. And I showed you a little bit of the data from the Adventist Health Study, and they've definitely shown that people eating more soya foods, certainly the men, have lower prostate cancer. I mean, these are all associations. And as you said at the beginning, Sandhya, that you can't pinpoint one food. It's the overall diet pattern, and soya is a really healthy source of protein. It helps lower blood lipids and is useful for cardiovascular disease modification too.
Yeah. The only thing I tell my patients is not to go overboard. Everything in moderation and part of a balanced diet.
Yeah, I mean, 2 to 3 portions is fine, but yeah, as you say, there's no point only eating that because you won't be emphasizing the variety of plant sources. So agreed, we wouldn't go over the top with any food, but it's definitely one to include.
Yeah. Is there any evidence on the benefit of whole food plant-based diet in preventing hematological cancers?
Yeah, well, that's interesting, isn't it? And I think the person you probably, if you haven't already invited her previously, is you'll want to invite Dr. Urvi Shah.
I
At,
think she's got this.
yeah. So then you kind of know the answer to that question. So there's a bit of data. So we've got observational data that people who eat more plants have less lymphatic system cancers and possibly less myeloma. So that kind of comes from the EPIC cohort. There's some American cohorts. Urvi's also contributed to a study looking at data from, I think it's the NHANES data that showed reduced risk of myeloma with a healthy plant-based diet. So there's definitely observational studies. Of course, we're never going to get a big intervention study that looks to see whether you can prevent hematological cancers through food. But we've got some information to suggest it's useful to eat more plants. And then Urvi Shah at MSKCC is doing the research that needs to be done, which is looking at a whole food plant-based diet in people with myeloma, starting with myeloma, because there's so many different hematological cancers, aren't there? But she's focusing on myeloma. And what she's seen already is that people eating more whole plant foods have higher levels of short chain fatty acids in their gut microbiome, and this is correlated with deeper remission and longer remission in people after cancer. She's also been able to show that more plant foods delays the progression of the precursor MGUS to myeloma, and then she's got some ongoing intervention studies that will answer some of those questions for us. So the work's going on, but I think there's definitely no harm in getting your patients with hematological cancers to eat more plants, because even though we've got some like highly curable cancers or cancers that can can still have a long life, we know that our patients die of cardiovascular disease, type 2 diabetes, and second cancers, all of which benefit from eating more plant-based foods.
Yeah. What lifestyle changes are recommended for endometrial cancer? Yeah, we know exercise.
All the same ones. I mean, it's one that's related with carrying excess weight for sure. So maintaining a healthy weight. I don't think we're at the stage where we can pinpoint for every single cancer what exactly we say. There are general principles that we can pull together that, again, eat more plants. And there's some observational suggestion that there's increased rates of endometrial cancer in people eating more dairy, especially if you think the endometrial cancer is driven by female hormones. And so, I would suggest people swapping out their dairy for soya because of the potential benefits. And yeah, eating more plants to help with a healthy weight is also sensible for people with endometrial cancer. I think coffee consumption reduces your rate of endometrial cancer, if I remember rightly.
Yeah, endometrial and liver, I think. Does regular intake of antioxidant supplements prior to cancer diagnosis affect the treatment outcomes or response to cancer therapy?
I don't know. I haven't seen that data, but I don't think we need to be taking antioxidant supplements if we're eating a nutritionally sound, healthy plant-based diet. If you're not having if you're vegetarian or vegan, you need to take a regular, reliable source of vitamin B12. But beyond that, I don't think we should be taking them anyway. And I haven't seen any data that can answer your question, I'm afraid.
Do you recommend protein powders when patients are on chemotherapy? What about those patients who need nasogastric tubes for feeding? Would carefully created balanced diet be better than protein powders or vice versa?
I think these are too difficult for me as an oncologist to answer. I mean, if you've got people on enteral-parenteral feeding, you need a specialist oncology dietitian that hopefully you have access to. I wouldn't be able to give you a considered answer. I don't have a problem with protein powders as long as you know what's in it and it's not, completely ultra processed. And obviously I'd go for plant protein powders. They can be a good way of increasing people's protein intake if people are struggling, older people, small appetites, sarcopenia, etc. But again, when it comes to NG feeding, I think you need a specialist GI and cancer dietitian to plan those meals for you. There's so many factors involved.
Yeah. So what about genetically modified soy? Should we focus on organic soy? I think
I mean,
we have
yeah, I mean, we're
we
lucky in
don't
the
have
UK that,
modified soy here. In
yeah, I think,
India, we have genetically modified soy.
say again, sorry.
We don't have genetically modified soy here in India. And I think
Yeah.
somewhere in the presentation you said that the level of evidence for any genetically modified food product is not established, right? In terms of
I didn't mention GMOs actually, but again, we're like you in the UK. We don't have GMOs either. We don't have GMO soy other than probably the soya that is fed to the animals. So I think in all context, if one can afford it, then consuming organic foods is best. Why not? We can reduce our exposure to all sorts of things like pesticides, insecticides. But ultimately, we have to do the best we can with the availability and resources we have, and we have to support our patients to do the best. And it may not be accessible, affordable for everybody to eat organic all of the time. And that's where we need system change, isn't it? I mean, there's great work being done in Denmark where their ambition, and they're nearly there, that 80% of the food that they supply the country is organic. But, countries like the UK are well behind. We haven't prioritized that at all. And it's, hugely expensive for people and we know the diet qualities are so poor already that then if we dictate on top of that, oh, it must be this, it must be that, it's just not reasonable. Eating more healthy plant foods, regardless of how they're produced, etc., is better than not consuming them for sure.
I think one last question. I'm not sure in what context. What is the role of beetroot in chronic diseases?
It's a very healthy food. What do I know about beetroot? It's high in nitrates. There's been randomized studies that were conducted by the British Heart Foundation demonstrating that 250 mils of beetroot juice twice a day was just as effective as a blood pressure medication. So it definitely reduces your blood pressure. So yeah, it's a high nitrate food. So wherever you'd want some, blood vessel dilation, I think it's useful. It's also been shown to be a good food for athletes, making that fractional different for a few seconds in terms of endurance and stuff in terms of in the athletic space of people taking it beforehand. So yeah, I think it's great. I mean, I'm personally not that great fan of it, but I try and eat it. So I think if you like it, go for it. It should be part of your varied diet for sure.
Okay. I think we've come to the end of the questions. There aren't any more questions. So yeah, I think we've come to the end of the session. That was really a very nice, informative, and enjoyable session. It was good listening to you and lots of lovely evidence that you brought forth on various aspects of lifestyle medicine with respect to cancer. Thank you very much.
Yeah, you're very welcome. Thanks for the invitation.
Thank you so much. Thank you.
Okay.
Thank you, ma'am. Thank you so much for all your support.
No problem. Keep in touch and yes, see you guys soon.
Keep in touch. Good night. Bye-bye.
Bye-bye.